Hello listeners, a warm welcome to Views on Health. I think it's something like 2 years since we last had Dr. Sajith Edirisinghe on the program, so a warm welcome to our studios, Doctor.
Thank you, Fatima. Thank you for the invitation.
Our pleasure. And for the information of our listeners, Dr. Sajith Edirisinghe is a senior lecturer and clinical geneticist at the Faculty of Medical Sciences, University of Sri Jayawardhanapura. And Dr. Edirisinghe also wears another hat, if I may put it that way. He is the current Vice President of the Sri Lanka Medical Association, the premier body of medical specialists in the country. Having said that, Dr. Edirisinghe's focus is on plastics and its impact on our health. As we know, there's so much of awareness being created on the negative aspects of the use of plastics. There was a time when plastics were so much in use in so many forms. However, now, thankfully, we see many people veering away from the use of plastics and going back to other means of keeping their water in glass bottles, avoiding drinks from plastic bottles, avoiding getting rid of packs once they use them and not reusing them. So these are what we see, which I think augurs well for getting away from this menace, if I may put it that way in quotes, because it certainly impacts on health. It impacts on the environment too. Am I right, Doctor?
Yes.
Yes. Having said that, may I invite you to introduce the subject, the impact of plastics on one's health?
Yes. Yeah, thank you, Fatima. So now, if we talk about the plastics, actually, now these plastics were introduced to the world in somewhere around 1950s or 1960s. But we were disposing these plastics in different formats to our environment from 1950s and 60s. But in 2004, a scientist has discovered a thing called microplastics. So until up to by 2004, we were not aware about this microplastics. That is, microplastics are the plastics which has been broken down to less than 5 millimeters in diameter. So these plastics are there in our environment. These plastics are basically from our whatever the byproducts that we throw out into the environment with our knowledge or without our knowledge. And so these plastics get caught to the vehicles. At the same time, they are exposed to the sunlight, the rain and the UV radiation, and also some people burn their plastics. So it is very harmful because burning can cause, it will eliminate a lot of toxic material. One such toxic material is called dioxin. So those are carcinogenic elements. So those elements are released to the atmosphere. So now, and also at the factory level, they produce these small tiny plastic beads, where those tiny plastic beads are now entered to the toothpaste and even for the face scrubs. And even these plastics are there in the makeups and the lipsticks and everything. So now, what happens when these plastics are there in the environment? These tiny plastics, which are broken down to the nanoscale, will be taken up by the animals which are under the which are microscopic animals. So you can't see them from the naked eye. You need a microscope for that. So these animals will be taken. They eat these plastics. So once they eat these plastics, these plastics will keep on going in the ascending order in the food chain. So there will be in technical terms we call it as a bioaccumulation. So it will go on, keep on bioaccumulating along the fish or whatever the land animals. So we do intake we do take plastic from our food. At the same time, these tiny plastics are there in your drinking water. At the same time, these plastics are there in the atmosphere where we breathe. So the scientists have found the most commonest pathway of entry of these plastics into the body is from our inhalation. That means air we breathe. So the food and the water comes in the second line. So the commonest pathway of entrance of these microplastics into our body by inhalation. So out of the scientists have gone into too much of details, and they have found there are fibers, microfibers, whatever the nylon cloths that we wear, when we wash them, tiny microfibers are released to the environment. And also from the fishing nets, the abundant fishing nets will generate a lot of microfibers. So these microfibers will go into our body. So when these plastic particles, either fibers or whatever the plastic material, when they are in the environment, from the environmental aspect, there are a lot of heavy metals and other carcinogenic elements that have been released by humans to the environment. So these plastics are very fond of absorbing these carcinogenic elements and the heavy metals. So once we have these plastics in our body, what happens is during the stay of the environment, we don't know how long that particular particle has been there at the environment. So we will ingest or inhale a plastic particle which has been released to the environment by 1960s. Still it is there, but we don't know. Sometimes we might inhale a plastic molecule which has released yesterday. So we don't know. So longer the duration they stay at the environment, higher the concentration of chemicals and the toxic material that they absorb onto the plastic material. So once we take up this plastic material, we take up it as a cocktail. So the old ones are also there, the new ones are also there. So once they enter to our body, it will go to the bloodstream. Through the bloodstream, it will go to our brain, the heart, the kidney, the liver, all sort of places. So once you reach the terminal regions, what happens is, it's just like a simple diffusion, the small practical that you all have done during your school days. So you take a glass of water and put a small piece of condensed or potassium permanganate. So you put it and leave it for some time. The clear water glass will turn into purple color. So it's just a simple diffusion. The same scenario will happen in our body. So what happens here is the plastic material which has absorbed all these toxic materials and the heavy metals are deposited in our body, and then once it is deposited, it will start releasing all these heavy metals and the toxic material. So these heavy metals and the toxic carcinogenic elements are capable of changing our DNA patterns. So all our cells contain DNA material except for the red cells. So this DNA material is responsible to develop cancers. Every cancer is having a genetic background. So what happens here is, there are three types of genes that we are talking about in our body. One is called oncogenes, where you promote cancers. All of us, even including myself and the people who are listening to this, are having these oncogenes, but they are in a silent mode. So the other gene is what we call as the tumor suppressor gene. So these tumor suppressor genes are in active format in our body. Also there is another gene called DNA repair genes. These DNA repair genes are also in the active format in our body. So what happened here is, when we have these chemical products taken into our body, we are exposed to these unwanted heavy metals, unwanted carcinogenic elements. So these elements can have an effect on these genes. So what they will do is they will silence the activated tumor suppressor genes and the DNA repair genes. So there are no place for our body to check out or suppress the tumor suppressor genes. Means tumor means the cancer, suppress means you suppress it down or keep it low. So once you silence it, usually it should be active. Once you silence it, there's no one to suppress the tumor. The DNA repair genes, DNA is the molecule, and the repair means you repair that particular damage. So once those are usually active, these chemicals, whatever the chemicals that are brought into our body through the plastics, can silence it. Once you silence it, that's it. There's no repairing. So when there is a damage happens, there's no repair. So the damage will continue forward. So usually these oncogenes, the third type, right? Those are in the silence format. These chemicals can activate them. These oncogenes, once it is active, so they will keep on helping producing of cancer cells. So this is how once you ingest plastics through your inhalation, through your food, through your drinks, these chemicals will enter and do alterations in these three classes of genes, and then it will start producing cancers. Recently the scientists have found there is another method where it can enter to our human body via damaged skin, not by the intact skin, through damaged skin. So through the damaged skin, in the sense, for an example, your pimples which are at your face, it is a damaged skin. So you use makeup to cover it. Certain makeups contains microplastics. So you use makeup to cover your pimple, but through that damaged skin, these microplastic particles can go into your body. So it is another problem. So in your lipsticks, it contains microplastics. So once you apply your lipsticks, it will go through your ingestions, because your tongue will touch the lips, and you will take once you drink or eat or whatever, the lipsticks will definitely contaminate your food and go into your body. So via those four methods, the plastics will enter to our body.
Thank you, Doctor, for that very detailed and lucid introduction to the topic of the impact of plastics on our health. Now, it's a question, I don't know how fair it is, but I have to ask you, across the world, not just in Sri Lanka, there are industries and plastics are being manufactured with approval. Now, how best can the products that come out be safe for human use? I mean, if you take anything, you take a straw to drink with, a cup, especially if you're on the run, you go for a picnic or you go on an outing, you won't necessarily take a glass tumbler. You will take a plastic cup, because even if it breaks, it doesn't matter, or you can dispose of it once you're done. Plates, whatever. Then getting onto cosmetics. You spoke of somebody trying to cover up a pimple. It's natural. I'm sure everybody has done it, all women. I don't know about men. Men also do get pimples, but it wouldn't matter to them that they need to cover it up. But for a woman, yes. And of course the use of lipstick. So automatically there's intake, as you say. How best can we protect ourselves? Or on the other side of it, are there sort of stringent measures that need to be taken by the manufacturers before they put such products out in the market?
Yeah, that's a very good question. So if you look at the international market, there are cosmetics with zero microplastics. So I don't know, I haven't seen it in Sri Lanka, but might be there in the Sri Lankan market. So I can't tell no for that in the Sri Lankan market, but might be there. But if you Google and see, there are good brands with zero microplastics. So zero plastics. So they assure that their products are free of microplastics. Who is concerned about their health, whenever we go on a trip, so you are not going to go on a trip tomorrow by planning today, no. You plan it for weeks, sometimes months. You book your hotels. So there is a planning. So you plan it for the environmental friendly manner. So it's better, because I know that taking a glass bottle is a risk, because when you are traveling with kids. But there are things, rather than your PET plastic bottles, there are possibilities that you can take water. Always make it as a habit of refilling, not just use and throw it away. Because sometimes you might be traveling to a very hot zones, because these plastic bottles are, we never recommend these plastic bottles, the PET plastic bottles, 500 ml, 1 liter, 2 liter or 5 liter, whatever. We never recommend them to keep inside a hot vehicle, because the inner layer, now the scientists have shown the inner layer of these plastic bottles are now being shown or proven to be shedding off. So it will contaminate your water. The chemicals will come into your water. The one such chemical is bisphenol A. There are certain literature, but we look at a tip of the iceberg, where the things that we don't know is very huge, because until 2004 we never knew that there's a thing called microplastics, but we were producing plastics from 1950s or 60s, right? So there are a lot of things. The scariest part is there are scientific evidence it will cross the placenta. It will cross the human placenta and go to the unborn babies. It will excrete through your breast milk. The microplastics will be excreted through your breast milk. So now think about the next generation, think about your children. So plan yourself in advance. Nothing is impossible. So if you have a intention, if you have a drive, if you have a passion of environmental friendly manner, it can be done. So always, wherever you go, that doesn't matter that particular plastic bottle has been there in the environment, it has not been thrown by yourself, but it's alright. Make it as a habit. Take some garbage bags wherever you travel, right? You do a simple thing. At least one, if you can remove one bottle and send it for a recycling process, that is a huge thing. Because if you leave these plastic bottles to decay, these plastic bottles, at least it will take 400 to 600 years. So until that time, up to 400 to 600 years, this plastic bottle will be there in the environment and produce microplastics. It will kill generations and generations. So at least if you can remove one plastic bottle when you're going on jogging in the morning, just as a habit, take a small piece of bag and collect whatever the plastic bottles and bring it and dispose it properly. I have seen a lot of people do that, and there are a lot of plastic dumping bins supermarkets. So that is a very good thing. So you just go there and dump it, because those plastics will be recycled. But more than recycling, we have to think about reducing the use of plastic. So no point of keep on recycling if you keep on producing and putting it to the environment. For an example, if you go to the internet and see, Sri Lanka doesn't manufacture plastics. We import the pellets and we put it into the molds, and we produce all sort of these plastic chairs and tables and all sort of things. But when you look at the data, we are in between the top countries for plastic mismanagement. Even though we don't produce plastics, we just import the pellets and mold it and produce the plastic cups and all sort of things. So the mismanagement is huge in our country. So the best thing is we have to start from the school education. You teach your kids. You start from your home. Have a separate bucket for the plastics. In certain food city chains I have seen, they have kept the plastic bins, one for hard plastics, the other one is other bin for the soft plastic. The soft plastic means your polythene bags and all sort of things. So it's another good initiative. So you bring all your soft plastics bags, your food wrappings, whatever the things, and dump there. They will recycle it. So a lot of people are having a problem to dispose these cellophane bags and lunch sheets, and also lunch sheet is totally a mess. So you should not use lunch sheets, because I will tell why. Because on these food wrappings there are some bacteria. Once you release it to the environment, there are certain bacteria and the fungi that can grow on these food wrappings. Those bacteria can develop resistance to the antibiotics. So now you talk about lot of antibiotic resistance. This could be one of the causes for the antibiotic, because in future we will run out of antibiotics to give for bacterial infections.
Thank you, Doctor. So very interesting, and I think it's a subject that we can talk on at length, but time is catching up with us. So anything else that you would want to share with our listeners before we wind up the program?
Yes. The most important thing is you reduce the use of plastics. Try to go for recycling and also reuse. And I would like to propose you all, whenever you go to buy some product, you rethink whether this particular product is necessary for me. Do I have an alternative for this product? If I have an alternative, don't buy. So you go to your kitchen after this program and say how many plastic spoons are there. Have a look at these plastic spoons that you are using for cooking, right? So if you look at the spoons very carefully, the spoon is not symmetrical. Certain part has been worn off. So please remove those spoons from your kitchen, because you are introducing a lot of plastics to your husband or the wife or to the kids, because you are going to kill your family. So please remove those plastic spoons which are already been worn off. At the same time, when you look at your chopping board, have a look at this chopping board. You might see the center part of the chopping board is very thin compared to the outer part, because you have been using this chopping board for years and years, and where this plastic has gone, it has gone to your meals. You have given the tiny plastic particles as food to your kids. So please think out of the box, think in a different line, and try to reduce your plastics. That can save the generations which will come in future, and teach your children not to pollute the environment. Thank you.
Thank you, Doctor. On that note of solid advice, we end this very interesting discussion on the impact of plastics on health. Thank you to you, Dr. Sajith Edirisinghe, Senior Lecturer and Clinical Geneticist at the Faculty of Medical Sciences, University of Sri Jayawardhanapura, and also the Vice President of the Sri Lanka Medical Association, for sparing your valuable time to be with us and enlighten us on the negative impact of plastics on our health. Thanks so much, Doctor.
Thank you, Fatima.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razi Kada saying good night, and looking forward to your company next Monday, same time, on Views on Health.